This PowerPoint presentation is mostly from chapters 2 and 3 of Communicating About Health by Dupre. So the learning objectives are students analyze their own experiences of interpersonal health communication. They will identify examples of health communication, discuss the impact of relational communication, discuss biopower, and compare how their own experiences or situations relate to those of others. The state of patient-provider communication currently, this is a snapshot, and then we'll go into more depth in a broader historical view. So there was a study published in 2001, and in it, the physicians used only 2% of talking time building partnerships and supportive communication. Patients only used 7% of their talking time asking questions and assertively conveying their concerns. So there's still room for improvement. In terms of a broader view, the histories of health power here, and Foucault wrote about historical changes in health politics. In the late 1600s, political power over life started changing from simply a state's right to take life away to biopower, which means power over the productivity of individual citizens and the ability to provide or not provide for a particular group's health needs. For more information about this, about biopower, see Michel Foucault's The History of Sexuality, Volume 1. Here we're seeing a picture of Sigmund Freud, and I put this here because he developed the talking cure. He turned away somewhat from objectivity and used ideas about subjectivity and brought them into medicine. And he collected Egyptian antiquities, and in particular, he liked to talk to a statue of the Egyptian healer Imhotep. Freud had a dog named Yofi. So Imhotep was part of an Egyptian medical community of around 2600 BCE, before current era. And then moving on to Hippocrates, who lived in 460 to 370 BCE, and he turned away from the idea of spirituality in medicine and had the idea that disease is best understood by a careful observation and logical analysis, a rational, empirical approach. So, but then there were these barber surgeons in the Middle Ages, and barber surgeons were often called on to perform simple surgeries, bloodletting, and tooth extractions. And historians believe that the stripes on a barber pole represent blood and bandages. And then during the Enlightenment, there was Descartes, and Cartesian dualism separated medicine into two branches. one for the mind and one for the body. Today, physical and mental health care are still often treated separately. Medicine started to change again around the 1800s. And during this time, people with access to orthodox medicine were finding it very effective, and folk medicine became less popular. This was partly due to the Flexner Report of 1910. It was commissioned by the American Medical Association from the Carnegie Foundation to report on the state of medical schools in the United States. It was a scathing report because most of the medical schools at the time were for-profit, and they didn't really cover the sciences or supervise hand-on experiences. And so in 1910, most medical schools were shut down. There was a growth in knowledge and technology, and this spawned specialization. However, this specialization presented difficulties for health communication. As people were focusing on particular parts of the body, physicians became less likely to ask about the stories behind illness. In addition, there was a great deal of discrimination in healthcare and elsewhere. African American patients and caregivers were not allowed into most hospitals in the United States until the 1960s. In addition, worldwide, colonizers and missionaries used health as a reason to take over lands, saying that people needed better health, and also take over livelihoods, and also influence belief. In the name of medicine, people were asked to convert. And not everyone had access to health insurance, even in the US by mid-century, of course, and as we know. So some in politics, particularly in impoverished nations, prevent delivery of supplies to groups of people who don't support them even now. So a few more vocabulary words: rational empirical, Cartesian dualism, Flexner report, capitation, point of service, HMO, PO, gag rule, copayment, high deductible health plan, fee for service, diagnostic related group, and catastrophic cap. A DRG establishes in advance what a funding agency will pay for a specific procedure. A patient with a managed care plan typically pays a copayment when he or she visits the doctor. A high deductible health plan qualifies members to establish tax-exempt saving accounts for health. In a fee-for-service system, patients and insurers pay the fees doctors or hospitals have established for the care they provide. A health maintenance organization typically hires health professionals, pays them a salary, and provides them with office and administrative support. By contrast, a preferred provider organization usually offers a discounted fee to healthcare professionals who treat patients in their own offices. Imagine you've agreed to pay 80% of your medical expenses out of pocket, but your medical bills are excessive. Based on your insurance policy, a catastrophic cap establishes the upper limit you will have to pay. Point of service is a hybrid between an HMO and a PPO. Subscribers pay an established amount to see preferred providers, but they're covered also at a higher rate if they see providers not on the list. If a health organization receives a set fee to care for a patient over a particular amount of time, this is called capitation. A policy that punishes managed care physicians for mentioning expensive treatments to patients is called a gag rule.